Hello and welcome to Oakville Matters. Today we're going to talk about coping for good mental health, no matter what time of year it is. We're going to look at all the different seasons of mental health. And with us today to do that are Melanie McGregor, who's a specialist communications and advancement at Canadian Mental Health at Halton Region Branch. And we also have Sergeant Dave Tutte, the Regional Community Mobilization Bureau leader, can I say that? And the Halton Region Police. And Deborah McGrath, who's the program manager of COAST at St. Joseph's Healthcare in Hamilton. And there's an interesting story there, starting with what COAST means, Crisis Outreach and Support Team, because acronyms are everything in life, right? Yeah. Now, when I said there's something interesting there, that's the partnership between Halton and Hamilton and how we share some services. Do you want to explain that to especially our Oakville viewers, although we also have viewers in the rest of Halton? But a lot of Oakville people aren't aware that we have neighbors, so.
Sure. So I manage the mental health professionals, the mental health workers, that in partnership with Dave, with Halton Regional Police, our staff work together providing service to Halton Region, and the team is called Mobile Crisis Rapid Response Team. So it's a uniformed police officer in a police vehicle responding to 911 calls involving persons in crisis, so that they have mental health resources in the moment of time.
Now, Dave, when did the police team up with the good folks from COAST and St. Joe's?
From COAST, Halton Police teamed up with about 10 years ago, and that's a program that has been evolving. And really, in December 7th of 2015 is when we began our partnership with St. Joseph's Healthcare for the Mobile Crisis Rapid Response Team. So just over 2 years ago.
So what were we thinking?
We were thinking that 80% of police occurrences are non-criminal in nature, and we know that from a police perspective we can deliver a much better service delivery for members of our community if we, the police, collaborate with our community partners. The police, however, we're not specialists in healthcare, so knowing that by partnering with St. Joseph's Healthcare or with CMHA, the quality of the service that we're able to deliver to our community members is that much better.
So if I'm in a mental health crisis and a police officer shows up, I'm probably not thinking that the police officer is a doctor.
Correct. The police officer is not a doctor, but we have mental health professionals who are out driving around with us.
So that's got to help.
Absolutely. What that comes down to is sometimes when people are in crisis, they need to go to the hospital, but it's ensuring that the police in partnership with our healthcare providers, we're taking the right people to the hospital at the right time.
So Melanie, we have a perception in the police, and I'm the chair of the police. This is how I've gained this, the perception has come to me as well, that since 80% of the calls aren't crime and 20% of the calls, 20% of the 80% seem to be mental health, and overall the calls for service go up 5 or 6% while we only grow 1 or 2%, what's that say about the state of mental health of the nation?
I think the awareness of mental health is definitely increasing. I think people are becoming more and more open, more and more willing to talk about when something isn't right and to seek out those supports. So the police are one option for help. There are so many different resources that are available in the community. So we're happy to cooperate with the police because, again, it gives us another way that we can deliver support. But I think it really speaks to awareness and people really speaking out and getting that support when they need it, which, yes, we still have a long ways to go in terms of working with stigma, but I think we've also come a long way in that people are reaching out for the help that they need.
One of the things that I've always wondered about is why in crisis people would call 911, which is, not a number that's advertised to get you mental health help. It's a number that's advertised to get you to the police. Mm-hmm. And there's amazing calls to 911 that have no business going to 911, but these need to go somewhere. Are there better numbers for people to call?
Well, 911, we tell people that 911 is the number to call if there's an immediate risk there. So if someone is seeing that someone may be a risk to him or herself or to someone else, they're fearing for that person's safety, then 911 would be the best number to call. So a number such as COAST would be a call if someone's in mental health crisis, but there may not be an immediate risk there, but they need to talk to somebody because they're having thoughts of suicide, they're experiencing some kind of crisis, and they need support. So there are other numbers that are available, but 911 is an option to keep in mind depending on the circumstances.
And the COAST number, which we were showing a second ago, is a number worth writing down if you ever think you're going to need that?
Absolutely, because we can't say how many times people have called COAST or learned about COAST and say, I didn't know this existed until I needed it. Well, it's a number to keep handy because you never know when you or someone else is going to need that crisis support.
Well, when I asked you earlier about numbers, I was very impressed with the fact that you knew the number by heart. So, Deb, are there any other numbers that people need to know? I think we have one more, don't we? Or did we already show that as well?
So the number we can offer from Canadian Mental Health Association is it's a good number to call if you need information about mental health, if you're looking for community support. So the number for CMHA Halton is 905-693-4270. So again, you may not look it up until you need it, but if you have it handy, we'll always be there to provide support.
Well, that's great. Now, is there a time of year when calls spike, or is it steady throughout the year, Dave?
From a police standpoint, we do see sometimes an increased amount of calls related to people in crisis during the winter time, during the holiday season. It's a particular time where we as a community, through our healthcare professionals, we need to make sure that we insulate those that are most vulnerable in our community.
So what do? Do you staff hire? What happens?
The CMHA, the COAST team through CMHA is definitely more out in the community during this time, and as well the Mobile Crisis Rapid Response Team. They are out there as much as they can be and available to support those people who could be going through some kind of a crisis, and really working at keeping them in the community as opposed to taking them into a healthcare facility.
Now, when you get to a crisis call, I'm imagining that there's some kind of sorting that goes on where you decide, is it really a crisis, or how does that work out? Yeah. Who can help me understand that?
I can jump in there. So from a Mobile Crisis Rapid Response Team standpoint, that's a conversation that is really equally had between the police officer and the mental health worker. The mental health worker has that much knowledge and the ability to really diagnose and to triage and identify if this person is really in crisis, or is this somebody that we can connect to a community service provider inside the community so that they don't have to take them to the hospital. Is there something that they can do to support them in that situation? Because the last thing that we want to do is take them to the hospital.
So,
I think the initial identification is obviously when the call comes into 911, dispatch are determining whether it is a person in crisis call. So they, if the Mobile Crisis Rapid Response Team are available, then they would be dispatched to that call. An additional feature that our teams provide too is a lot of consultation to frontline patrol around calls that they may be on. And consulting around what would be best for that client interaction at that time.
Do we get these calls on a daily basis in good number or big number, or is it more of a weekly thing? What's the frequency in Halton?
This would be on an hourly basis.
You're kidding.
Yeah.
So the one of the things I'm fond of repeating is that Sir Robert Peel said that the police are the community and the community are the police. And neither the community nor the police are trained or experienced in how to deal with mental health. So I'm very glad that we have these partnerships. But how do we attribute this constant increase? What's driving that? You said awareness that there's help, and Dave, you said in winter. I guess in winter people are more isolated or less likely to be outdoors. Or maybe just isolated, and maybe isolation is part of the issue. What seems to drive this?
I think for sure the weather can play a factor on people, because if they're exactly that, if they're isolated and they're staying home and there's less opportunity to maybe get out, that can definitely have an effect on somebody's well-being.
And I mean, I've heard, I'm not licensed to practice medicine of any kind, but I've heard that activity is a good antidote to the blues. Does that extend to mental health?
Absolutely. I mean, when we think about the winter blues, often it does have to do with people getting out more, getting less sunlight, because it's that vitamin D and sunlight, right? That can sometimes boost our mood. But it's also connecting less with people and possibly exercising as well, because, you know, when it's snowy or it's cold, people may not want to go out for that daily walk. But it's finding what are some other ways that you can build in exercise, because it really is great for our mental health.
So that must be why my wife takes that daily walk. I better think about my behavior.
Well, there's a number of things. I mean, it's the physical reactions, you know, you get that blood pumping and the energy going, but it may also be a great time to relax or do some deep breathing, get your mind off some of those things that are stressing you throughout the day.
I don't think about anything. No stress ever happens.
Yeah.
I think some people that are dealing with chronic mental illness also, there's a cyclical pattern to their mood, and typically, especially for people that are suffering from bipolar disorder, oftentimes the fall through to the spring is a very difficult time for them. So I think just acknowledging that as well, that the cyclical nature can often impact, as well as the holidays. You know, the holidays are difficult for a lot of people, especially if they're estranged from their families. They're typically, historically, we can see that there are increased rates in suicide around the winter and on holiday time. So it's just making sure, again, that, you know, we're reducing stigma and letting people know that there is help out there.
That's amazing. I remember when I was a youngster, starting out in life, I was making films. I made a film about an emergency room, and all the doctors and nurses assured me when I went to do some research that I should come on the night of a full moon, that there'd be that the full moon brought the most business to the ER. So we went, and that particular full moon, nothing happened. All night long, nothing. And we wound up going back on a regular night, and there was plenty, so I guess there was a delayed effect. But I was really shocked by the sort of conventional wisdom not being true in that particular case. But it's fascinating to hear that in this case, the colder into the year does have something to do with some of these more serious. I mean, those things sounded serious to me. And is there any medical science behind or theory about why?
There's lots of research out there, and they're continuing to look at things. I think some of the things are chemical imbalance and the impact that the environment may have on people's moods as well. You know, as Melanie said, you know, the darker nights, the weather, the self-isolation. As well as I say, the chemical imbalances in the brain, and you know, I think all the other factors contribute to that and increase symptoms.
So there could be some virtue in sending people like that south.
They do. Some physicians will prescribe light therapy, sun lamps, to help with especially seasonal affective disorder at this time of year, or increasing vitamin D. But a vacation certainly wouldn't hurt anybody, I don't think.
No kidding. There you go, a medical reason to take a vacation. Everybody got theirs planned. So Dave, what's the future look like for the Halton Police with respect to coping with mental health?
The police are really focusing on upstream intervention, and from a community safety and well-being standpoint, what can we do and who can we partner with in order to really deliver the best services that we can. We want, as a police service, we know that we are going to spend time as an emergency response or an incident response, but we want to spend that time upstream if we can to prevent someone from falling into that crisis. So right now, partnering with Coast and delivering programs with CMHA, but also we have a crisis aftercare worker who specifically focuses on bringing somebody out of that cycle of falling into crisis and works as a temporary case manager to really support people in the community and connect them to services. So from a policing standpoint, spending that time upstream to prevent someone from falling into crisis is really one of our goals.
And is the aftercare worker a police officer or a civilian?
So it's an employee of the Halton Police, but it's a civilian employee who is a social worker.
So I remember there was a time when we had social work agencies, and there were lots of social workers. They seem to have disappeared from society.
The social worker, because the police, we can't provide clinical support for a social worker. So it's somebody who reports to me, but I don't have the clinical background to be able to support them. So we partner with CMHA for that program so that the manager at CMHA can provide that clinical support. So that social worker spends a couple days at CMHA in order to really get that support that she needs in order to deliver that program.
So now when you and your teams decide that somebody's got to be taken to hospital, and you've tried everything to avoid that, when you get to one of the hospitals, Oakville, Burlington, or Hamilton, because I guess you can't go to Milton or Georgetown for this because of mental health only being at the big ones. How does that interface work? Do you can they handle the intake efficiently? Do we sit there forever? What goes on?
Well, fortunately, from a healthcare system standpoint, in our community, Joseph Brant has gone through renovation just recently. Oakville Trafalgar has gone through renovation. So those hospitals, their ability to triage people in crisis and to get them the help they need has got only that much better. One of the big benefits of the partnership with St. Joseph's and with CMHA is that there's healthcare providers who are bringing people into the hospital as a part of a team, and they're speaking the same language as the doctors, which is a huge advantage as opposed to a police officer explaining why someone's been brought into the hospital.
So those days when there's a picture that I have of 8 police vehicles waiting at Joe Brant. Those days are gone, or it's better now?
Those days are definitely on the decrease for sure. The wait times at both hospitals have decreased, and with the recent renovations and with training and the partnerships with both of our healthcare providers here, we've been able to really reduce the wait times at those hospitals. Yeah,
I think they're both much bigger. Oakville Trafalgar Memorial Hospital, as a result of the new build up on Dundas, I think it's 50% bigger. I don't know how, I'm pretty sure Joe Brant got bigger as a result of the patient tower, but I don't know. Do any of you by any chance? Well, Burlington, we're pretty sure it's bigger. We just don't know how much. You know, it'd be so ironic if it was even more than 50% bigger, because Oakville, Burlington kind of thing.
51% bigger.
51, yeah, exactly. So, you know, be happy. You know, for many, many years, Burlington was the biggest community in Halton, and by a lot. And by a little now, Oakville's bigger than Burlington, so we have to work hard on our relationship. We're the younger sibling who got bigger. So I'm actually startled to hear that the wait times has improved. I'm going to have to stop complaining about it. Maybe I doubt my complaining did that much good.
But it can always get better.
It could get better? I'd like to know that.
Yes,
like, how much better can we make it?
Well, we can always get better.
So drive by and
drive by, just a drive-through. The big thing is that we want people in crisis and clients, we want them to spend time in the healthcare system, not in the police system. And that's the real push behind behind reducing those wait times. The best care that someone who is in crisis is going to get, it's from a healthcare provider, somebody who's in a hospital. And that's really why we're working at reducing those wait times.
Now, this is a wild hair kind of question, but do we ever send EMS to these calls, or do we always send police with Coast or mobile response?
The police will respond with, as a part of the Mobile Crisis Rapid Response Team. The Coast program is the follow-up piece. So the person was in crisis, and now Coast is going to help see them through.
So secondary response.
So the police will respond with as a part of the Mobile Crisis Rapid Response Team, and they'll respond with paramedics.
And then the aftercare workers, is that a third layer?
Yeah, that would be the prevention piece through that community safety and well-being situation. So we have our emergency response, and then we have our risk mitigation, and then the prevention piece is really that crisis aftercare worker.
So now, to what extent, Deb and Melanie, have you heard of community safety and well-being planning? Are you familiar with what we're doing on that?
Mm-hmm.
What have you heard?
So I know I was at the launch for that plan, and it was really exciting to see that well-being was included as part of safety, because often when we think of safety, we think of crime or things like that, but that well-being really brings in that mental health piece, which is so important. So I know that there's a couple of the priority issues are focused around mental health, which is really exciting to see that that's being included in there, because if we can get youth help early, if we can get adults help early, if they're struggling with their mental health, the hope is it would prevent that problem from becoming more serious, and then prevent other kinds of interventions down the line, such as police or such as hospital, if we can really get that support early. So that's exciting for us to see.
Yeah, the mental health piece of the workload of the police really drove the awareness that well-being has to be a focus. Mm-hmm. And that really was, I guess that's another way of saying the upstream part that Dave was talking about. Do you know if anybody if Hamilton is working on a community safety and well-being plan?
I know that there is some planning around that. The specifics I don't know. Certainly St. Joseph's Healthcare Hamilton, we're always adopting new initiatives, and well-being is number one priority. The services in Hamilton, I think there's a lot more mental health services in Hamilton than there are in Halton, especially with St. Joe's. So we're always looking at different ways to get ahead of the game and prevent, and I think it's also a good opportunity to promote more awareness for mental health and crisis. And, crisis can mean something different to everybody. Crisis may be not being able to pay your bills this month, or, significant mental health. So, we use the term loosely, because crisis to one person may be very different to another. With regards to our Mobile Crisis Rapid Response Team, I do want to mention that it is, our teams are available 7 days a week, from 10 a.m. to 10 p.m. is one team, and the other team is 1 p.m. to 1 a.m. And then obviously there may be room to extend that in the future if the needs arise, but that's currently what we're budgeted for. And as you said, in terms of wait times, the number one goal of our team is to divert from hospital wherever possible, so that people are getting connected with community services, opposed to waiting in the emergency department for hours to get a referral to psychiatry or a community program that might be able to help them. So that was one of the main things behind initiating the Mobile Crisis Rapid Response Team, and Hamilton have been doing that for quite some time. I also manage the same Mobile Crisis Rapid Response Team in Hamilton as well, and the LIN are actually standardizing the model for Mobile Crisis Rapid Response across the region.
Well, that's That's actually very interesting because I've often thought Halton's 500,000 people, maybe touch more. Hamilton's more than 500,000 people as well. And this partnership really shows that sometimes you got to be 1 million and before you can actually deal with something. I was very struck by the answer that Dave gave earlier about how the calls are hourly, and sounds like there's a little gap between 1 a.m. and 10 a.m. And does that mean that people wait till 10 a.m. to call in?
Those numbers, when we created the shift schedule, analytics told us that the majority of the calls are from 1 p.m. Until 10 a.m. That's when a large bulk of them happen. That being said, they happen 24 hours a day. They can come in at 6 in the morning, 8 in the morning. They can come in at any time. But
so 911 is 24/7. So we would have a handle on how many there are.
That's correct.
Coast is also 24/7, so if it's a time maybe when the mobile visit isn't available, Coast is always available. If that's a case where there's not an immediate crisis but someone's looking for some support, there's no immediate risk for safety, Coast is always available.
It's remarkable to think that people are suffering through the holidays and the winter times, and I take it it's more than seasonal affective disorder or SAD. You can feel sad without being in mental health crisis, I guess.
Absolutely.
But still sobering to think that there are people with those problems, and I hope that they can get the help they need through these phone numbers and through our program. It's been very good of all three of you to come and share your information with the public, and our show will be posted on the internet, this new thing called the internet, so that it can be a kind of a reference. I thought that what you had to say was all very interesting, and I hope people will get some benefit from it. Would you each like a final word?
Sure. I'll take it.
You'll take it.
One thing I'd like to let people know about is we've talked a little bit about wait times, that it can be challenging to get services, but we at CMHA offer free walk-in counseling 4 days a week throughout Halton. So in Oakville,
Where?
So in Oakville, it's Wednesdays from 1 p.m. to 7 p.m. at our office, which is at 1540 Cornwall Road. So no appointment, no cost, no referral. Anyone can just walk in and talk to a counselor for an hour about anything that they might be struggling with.
I never knew that.
Yeah, it's been great. It's a place that people can go with no wait if they just need to connect and just need to talk to somebody. So we'd love for people to come out to that. It's also available in other communities in Halton as well, which people can check our website for.
Well, it's great to end on a bit of good news. Thank you for joining us, and I hope you'll join us again when we do Oakville Matters.